Hello world, Dr. Keith Grimes, the VR doctor, here on day 6 of my exploration of virtual reality as a medical consulting space. Yesterday we looked a little bit about whether virtual reality could mean the end of the patient information leaflet by using some of the new neat technology here. And I've decided to revisit it because I didn't get a chance to show you one of the coolest things, which is these 360 videos. So let's have a look at this. Now, yesterday we spoke a little bit about all the tools that you might have, including some 3D drawing. And 3D drawing using the stylus is a very cool way of doing that. Of course, I've got the stethoscope from doing a 3D drawing. And I'm going to be trying to explore that a little bit later on using 3D models. But today we're going to come back to the use of 360, clear that away, 360 video. Now, we'll start with just some normal video. Dr. Michael Samy, who is a member of VR Doctors, posted today and showed something really cool. Now, we were talking about ears yesterday. And if you remember, if I get a moment, I should even be able to bring up that drawing of that fantastic ear that I made. Let's just shrink it down a little bit and look at that there. So, Dr. Samy used a CT head scan and was able to visualize this little section here. So if I just put this aside just now, we'll put that just here, and then why don't we take his video? Now this video will project, I may need to adjust this afterwards, but if, say I was speaking to you using Facebook Messenger, so you'd see exactly what you're seeing right now, or if you were here at the table with me, we'd be able to have a look at this and be able to narrate it. So this is a tour of a 360 visualization of, as if you were standing as a tiny little person inside the external auditory canal. And it's a fantastic little demo. Here we go. And we'll move it around. Now, I'm going to go back a little bit because it looks like it skipped to the start. There we go. Okay. There we are. And I'll just get rid of the table. So you can see here now that it's turned around, and this is a view down the external auditory canal. And it looks like in this picture, the tympanic membrane, the eardrum, has actually been removed. And you can see some of the ossicles, the small bones in the ear that transmit sound from the vibrating eardrum through the middle ear space and through to the inner ear, which is connected to a small window that then transmitted the vibrations from air into this fluid medium that then is picked up within the cochlea and converts the sound into electrical impulses that go through to the brain and allow you to hear. Now, this video here is just what looks like Dr. Samy's been working in Unity to try and take the CT, that's amazing, isn't it? CT data from a CT head scan and looking on the inside. And of course, he's actually posted because he's looking for some assistance. So if there's anyone out there who's interested, who has Unity or Blender experience, why don't you join VR Doctors? And then we can maybe connect you together with Dr. Samy and see if we can turn this into something a little bit more featured to help patients understand a little bit more about the anatomy inside the ear. So I'm going to bring up the table again. And I'm going to stop this just now. And we're back in my consulting room. But you know, I'm a little bit bored of my consulting room. I think today I'd rather be on the top of a mountain. Lovely and fresh. There we go. Why don't you guys have a look at the view? What have we got around here? That looks very much like Cervinia, the Matterhorn, taken from the Swiss side. Oh, wouldn't I love to be skiing? Anyway, let's come back to here right now. So, standing on the top of the mountain, let's have a think about what 360 video can do. And the first example of 360 video that I'm going to take, I clear this out of the way, is the work of Mr. Shafi Ahmed. Now, Shafi Ahmed is a brilliant, brilliant and enthusiastic and entertaining visionary on the world of the use of virtual reality and augmented reality and technology in general, actually. And last year, it was him that inspired me to do more with this, with his work in doing the world's first broadcast in 360 of an actual operation. Now, his company, Medical Realities, has a platform called VR and OR that you can download and you can use even with Google Cardboard, low-cost VR solutions to help with education. So if you were another doctor, we could come in here and we could discuss this. Or, by using this orb, you might be a patient who's away to have an operation and you want to know a little bit more about the experience. So why don't we all go in and have a look?
Welcome to the virtual surgeon demo by Medical Realities.
Now I hope you can hear that. I've turned the volume down a little bit. I'll be quiet for a moment.
Look around throughout the experience to gain a full perspective of the patient journey. Throughout the demo, tap hard on the side of the headset to alternate between video feeds.
There you go.
Good morning,
So,
Mr. Smith.
aha!
How are you feeling today?
We've got the consultation. Let's have a look around and see. We've got some junior doctors coming in to speak to us. And we're taking the view of the patient.
I'm a medical student and I'm just going to examine you if that's all right.
So just to go over a few things, I just want to make sure you haven't had anything to eat since last night. So I want to make sure we've explained the procedure to you, you're aware of the possible complications, and that you're fully consenting to everything. And I want to let you know that the anaesthetists have had a look at your medical
Google
history,
glasses.
examined you, and they're quite happy
Excellent.
to go under the
I like that.
anesthetic and go through the surgery. So the next step for you and the next step for us is to get you into the prep room and ready to go. So hopefully we'll see you soon, all right? Great, thanks.
Thank you.
So at this point, we're taken out of prep into what looks like the operating theatre itself. And hello, who's this down here? Who's this fella? This, where is he? This man is the amazing Shafi Ahmed. And he's going through the WHO checklist right now. Now, I'm kind of floating above it all just now, which is an odd perspective. But if you look down, I am floating above the operating table. Isn't that amazing? There's the checklist just now. They're working through things. And if I just have a look around the room with me in the foreground, you'll see all the theatre staff. And what's that just there? Again, not for the squeamish, but this is the view from inside the endoscope. And I'll be quiet a second.
By using ultrasonic vibrations, the harmonic scalpel can simultaneously cut and cauterize tissue to avoid bleeding.
Harmonic scalpel, isn't that cool? And it looks like I've lost my stethoscope somewhere along the way. Oh no, I'm going to bring it back just now. There you go. So, let's take it back down again, okay? So, we're using this, you could be a patient, I could be explaining to you about who these different people are, and maybe help discuss with you, get your any of your concerns about the procedure that you're going to have. So, now this is a fairly common idea that I sort of bump into. This is exquisitely realized by Shafi and his team, and there's lots of other people looking at this. We've got some people on VR Doctors and other people that I know that are looking at doing this. It seems to be hospital based as well, because people often don't know what it's like to go into there. So I'm just going to stop this for a moment, or pause it. So everything's paused there in the background just now. So what else could you do? Well, there's pre-visualizing an attendance somewhere. And in fact, that's something that I'm working on with the team at Royal Brompton and Harefield in a project called Prevent ICU Delirium. We're going to use this kind of technology for patients who have an admission to the intensive care unit. Now, if you go to intensive care, or anyone that goes into hospital and has an operation, they might have something called post-operative delirium, which is this period of confusion after an operation that can delay your stay in hospital and complicate things. And you can do your best to try and optimize the patient, but up to over 80% of patients going to intensive care have this. Now, if you can reduce anxiety in patients going in for operations, the evidence suggests that that can reduce post-operative delirium. And we also know that if you have patients and you take them physically into intensive care, it reduces their anxiety. So Mr. Sunil Bhudia, who's the cardiothoracic and cardiothoracic surgeon, and Alex Rosenberg up at the Royal Brompton are working with this idea that maybe we can do this in virtual reality, which allows you to do it for everyone, not just those few people that you can take through. We're hoping to take that to trial next year, which will be amazing stuff. So 360 visualization of the space that you're in. And you could be sitting at the table with me or watching from there, and we could discuss things. But what else can you do? Well, I'm going to minimize this, and we're going to go back to, we're back into the park just now. I still prefer to be inside the Alps. There we go. How about that? So, we've got video, we've got 360 visualization of the space that you're going to go into. Well, how about if you use 360 video to simulate what it's like to have certain conditions? And this is really exciting stuff. I talk about the 5 ways of clinical virtual reality. And the 5th way, which I band under expanding, is about breaking down barriers and giving new perspectives. So how about giving new perspectives to a patient with diabetes? Now, I have here a video that I've borrowed from YouTube, from Merck, and it's in Spanish, so you might hear some Spanish in the background. But what this aims to do is simulate what it's like visually for a patient who has diabetes, who has hypoglycemia. Now, hypoglycemia is where the blood sugar drops below the drops quite quickly. Now, the brain requires glucose to function. So if the blood glucose drops quickly, either through an unexpected challenge in terms of exercise, not eating as much, or maybe taking insulin, too much insulin, or maybe for no reason at all, it can make you feel dizzy and unwell. Now, for patients with diabetes, this can be a particularly scary experience. So maybe you can actually train them a little bit as to what it might be like. Now, I'm not diabetic. I don't know personally whether this is what it feels like, but this gives you an idea of what it might be like. So blue orb, center of the table, up it comes and starts playing. Now, if I turn around, this is the view that you might have. Now, and this is a little bit blurry, but this person is kind of talking to you. I think the sound has gone from this as well. But look how the view gets blurry and starts shaking around, and the person realizes they're having a hypo in the background and brings them quickly a form of energy, a form of glucose in a drink. It looks like that, so it looks like orange juice there, brings it up and hands it to the user or the patient who has it, and then with the blood sugar rising, everything normalizes. Now, I'm pretty sure that this is happening quicker than you might imagine. Oh, there you go. She's quite happy to have saved your life. Who wouldn't be? And here we are back in the Spanish living room. Anyway, that's a quick tour of what 360 video might do to help with education. I hope you've enjoyed it. My name's Dr. Keith Grimes. I'm at Keith Grimes on Twitter, and I'm going to be archiving these videos on the Twitter account, The VR Doctor. You can also join VR Doctors on Facebook and listen to my podcast. There's a picture like this. Oh, hello. Everything's gone dark. Seems like a good chance for me to go